Facial makeovers include facelifts, brow lifts, eyelid surgeries, nose surgeries, chin implants. As the years go by, there's a downward trend to the soft tissues of the face due to gravity and loss of natural facial elasticity. So we find that we start developing jowls and getting some square pouches here and getting wattles underneath, and our brows drop and the like. Our eyelids sag. The degree of lift involved really varies from patient to patient. Some people need quite a lot to be done. Some people need not so much, and often just a mini lift. We show before and after photos of a variety of other patients who've had things done, and very often we can find a patient who's very similar to the patient who's being interviewed. Also, just moving tissue in front of the mirror, I can give a patient an idea of how much change we can reasonably expect. We also have a morphing technology on the computer so that we take photographs of the patient to bring up the neck or bring the chin forward or change the nose or erase the eye bags or whatever, so you can kind of get some sense of that. For a facelift, most people are down for 2.5 to 3 weeks. A mini lift can be less than a week. Brow lifts tend to cause a bit more bruising, so that the recovery period for those can be 10 to 14 days. Scars, of course, mature over time, and early on look like red lines, and over time fade and usually become fairly inconspicuous. But there always are scars. There's no way that any surgeon can do these things and leave no scar. Patients often say, am I too early? And there isn't too early. It's just a matter of how much the specific problem is bothering them. And if it's bothering them quite a lot, then there isn't too early. We go ahead and fix it. And if it's not a big issue at all, and even though someone else may think so, there's no reason to operate on it.